So I would like to welcome everyone to the International Childbirth Initiative webinar series. Today, we are having a global conversation about doula training and integration into health systems. And this is a bit of an on-demand session that is following on a webinar that we held back in April, where we were presenting doula programs in different countries, including Mongolia, Kenya, Tanzania. So if you missed that session, it is on our YouTube page. If you go to the International Childbirth Initiative YouTube, you can see those presentations. That recording is still up, and we're not going to be going through some of the basics. We also have a webinar going through the evidence for doulas, which is our step 4 webinar that's also available on the YouTube page. My name is Michelle Scartharian. I'm the Executive Director for the International Childbirth Initiative. I think most of you also know Deborah Pascali-Bonero, who is the co-chair for the International Childbirth Initiative, as well as the chair for the International Mother-Baby Childbirth Organization that sponsors this webinar series. Ray Davies from the board of IMBCO is also here with us today. So thanks on behalf of all of us for joining this session. And I want to go ahead and start to introduce you and thank the organizations that are working with us today: the European Doula Network, Fernandez Foundation, Common Sense Childbirth, and Umzayana Birth Services, and Tiluna Imhotep. And Esther Kamani is also going to be representing DONA. I'm sorry, I don't have the DONA logo up here today, but we've got quite a lot of people represented on today's panel. To make sure we've got everybody, if you can please go ahead and keep yourselves muted until we get to the discussion. When we get there, happy to have you unmute. But these groups and individuals cover a wide range of geographies and cultures. So we are really hoping this session will give you a sense of what unifies doulas in different contexts, as well as what are the current barriers to successful integration in hospital and maternity settings. So please have your questions ready. And I want to start us off with a quick question specifically for the healthcare professionals who are with us. I'd like to know if your facility has a written policy for doulas. And if you don't have a written policy, do you have doulas who occasionally work in your facility? So I'm going to go ahead and put up this poll for you to respond. While I go through the general introduction for ICI, which I think many of you do know. Let me see if I can get here to my window. There we go. So for those of you who are new, the International Childbirth Initiative is a framework for the implementation of safe and respectful care practices and policies implemented through the 12 steps for safe and respectful mother, baby, family, maternity care. It is implemented through individual health facilities who opt into this process for self-evaluation, reflection, goal setting, and community participation. And we provide a global resource network that strives to share our learning and improve the provision of care. ICI was created by the International Federation of Gynecology and Obstetrics, the International Mother-Baby Childbirth Organization, the International Confederation of Midwives, the International Pediatric Association, and the White Ribbon Alliance. And we are open to all birthing facilities who are willing to commit to delivering safe and respectful mother-baby family-centered maternity care. Okay, so I just want to go ahead and share those results for those of you who responded. So we've got 29% who have doulas and a written policy. We've got 32% who have doulas, but not necessarily a policy. And then almost 40% of the folks with us do not have doulas practicing in facility. So this is hopefully going to be very, very helpful for you. And also helpful for those who don't have a written policy yet. So again, touching on why we focus on doulas so much when we talk about the 12 steps of ICI. Doulas are really supportive of many, many aspects of the 12 steps. But I want to particularly emphasize step 4, which is the mother's right to continuous support during labor and birth. Obviously, doulas are critical and in enabling. in enabling women to have continuous support throughout labor and birth. Step 5 is offering non-pharmacological comfort and pain relief measures. And of course, doulas are very often trained in these comfort and pain relief measures and therefore very much able to support Step 5. Step 6 is to provide evidence-based practices that are known to be beneficial for the mother-baby family. And doulas really have a key role in helping families understand what those evidence-based practices are, what those choices are, and helping to orient women with information going into the birth. And then actually critically, step 7, which is where a lot of the evidence lies around avoiding potentially harmful procedures and practices that have insufficient evidence of benefit outweighing the risk. And that includes unnecessary cesarean section. And we know that doulas have a really important impact on helping to bring down some of those intervention rates. So if you are in a facility that's facing high interventions, we know that integrating doulas is a strategy for reducing at times the need for those interventions based on the evidence that we have to date, and as well as increasing women's satisfaction with care. So we can't really underestimate the impact of introducing doulas. So with that, I would like to pass this over to our first presenters from the European Doula Network. And I believe Anita is going to get us started.
No problem. Okay, so hello everybody. My name is Anita Budak, and I am one of 3 co-organizers of European Doula Network. You just heard it, Debbie and Aishegul is also here. The 3 of us are trying to hold together a really big group of doula associations and trainings, but I will speak about that a little bit later. So today I will be presenting what we have explored about doula trainings inside European Doula Network, which is a really big network. And we had 14 doula trainings that answered this survey about questions that Michelle asked us. We will share this Excel where you can go into detail and see what we have written there. You can see that there is such a vast differences between doula trainings in Europe. We will put it in the chat, but also, as I understand, you will get the presentation. So every link we have, you can see it later. So EDN is a non-profit organization, and we do not credit training programs. So this is important to us, for you to know. Okay. So I am tasked with this beautiful task to explain for you who are not doulas, who are medical workers, what is a doula. So we really had this interesting discussion about the wording doula. As many of you know, doula comes from Greek word servant. And there are usually some of trainings or associations are not using this word, but we really want to use this word because we think that it emphasizes what we do. We serve women. So doulas are non-medical trained persons, usually women, but we have also men who are providing emotional and practical support for birthing women and persons. So what does this mean? So we do work with our emotions, and we work with mothers' emotions. We work with their fears, with their thought processes, with everything they have inside of them, with the emotions. We worked with them also on the physical level. We use our body to help their body with the pain, with the non-medical and non-pharmaceutical measures to help them with the pain. And I think that it is not really spoken about, but we use our nervous system as trained doulas who are trained to be calm in these situations to co-regulate the mother's nerving system. And also we are informational support. So we give support with the informations. Usually we try to do evidence-based informations about many practices and procedures. but also informations that are really common, like where to find anything in their local community. So we do a lot of things, but nothing of that is medical. So I wanted to make this distinction very clear. Usually, we are not part of the family members, as a birth companion can be. Usually, we are not paid by a staff. We are not a part of the team of some institution, usually. And we are some sorts of freelancers. So our boss is always the mother and then her family. We have really done a lot of research on our doula trainings, and we have a lot of links you can find about what EDN is. We have so it's a really interesting story about how EDN is funded. So interesting that we actually made a web documentary series, so you can find this and learn more about it. But if you see this map, the purple countries are all countries where we have member associations and training. So now we have 65 members, 35 associations, and 30 training programs. Some associations are also training doulas, and we cover 28 countries in this year. So a lot of doulas in EDN. It is really important to say how can you become an EDN member as an association or a training. So we have this doula code of ethics that all members have to agree upon. And this ethic code is really based on the main aspects. Why? And why not have one for all that is more in detail? It's because in Europe, we have such a big, vast of differences in language, in culture, in political, in legal sides of birth. So all of our members have their own code of ethics that will be more in detail for their country. We have translated our code of ethics in 22 languages. So if you want to translate in your language, you can. We have created this QR code that is easy to use, and you can see the everything on our website. So we were officially established in 2011. And the trainings and associations and doula friends, which are doula individuals that do not they're not a part of any association. We proud to connect and support and inform each other. So EDN is created to connect doulas and exchange experiences and knowledge. So here are the points of our code of ethics. So as I said, we provide emotional and practical support to individuals, parents, and families, and do not perform clinical tasks or give advice. We support informed choice without directing decision-making. Doulas treat clients, families, colleagues, and other professionals with respect and courtesy. And they conduct themselves with integrity and transparency. And doulas respect the privacy of clients in accordance with the GDPR, which is, for you that you are not in Europe, it is a data protection law. It is very important in Europe. And of course, doulas engage in continual personal and professional development and contribute to their own networks of care in local and wider communities. So this is just the main points of our doula code of ethics. So as a big organization that we have a lot of doulas, we started to think that we should have some data on all of these doulas in Europe. So we conducted a couple of surveys for doulas that you will find very interesting in regarding today's topic. So first doula survey we conducted in 2020. So doulas in Europe answered, and again in 2023. And for this presentation, we have decided to present some of the findings around the trainings. So as I said, the doula trainings are very, very different. We do not have one fit all training. Even in specific countries, there are different kind of trainings. But in this survey, we have come to this conclusion that over 70% of members have local doula training created by a local doula organization, and around 25% are having international doula training. So what does this mean? The ones who have local doula training with their own trainers are the countries where the doulas are practicing for a longer time, and they already have established the community, the knowledge and possibility to create a longer training that have their own local training on their own language. And in these international doula trainings are usually in the countries where there are no doulas before, or they're just starting out. And so they usually it is a donna's training that's coming to these countries and starting the seed of doulaing in these countries. So again, we asked what kind of type of training that was. So we have like over 50% live training, 17% online training. But in the survey from 2020, this was much lower percentage. So pandemic did its thing. So we now have a bigger a percentage of just online training, but combined in live online training is 23%. Workshop trainings, it's like the ones who is just a weekend training, like a donna's training, we have 20%. And this is really beautiful statistic that almost 40% of trainings are extensive, long trainings with multiple workshops. So much more material is taught to doulas in these trainings. So 70% of these trainings have mentorship program, which we find very important. Why the 31% doesn't have? It's usually the countries that the doulas are still very new and still don't have enough local doulas that are experienced to provide mentorship like this. Certification for our doulas in our network is important. So 70% are certified and 20% in the process of certifying. And the ones who said that they're not certified, that they just finished the training and didn't go through the certification, the reason is, first of all, language. Usually it's in English. And second of all, in many of these countries, you do not have legal home birth, you do not have birth centers, and so and hospitals may not allow doulas. So how can you even enter a birth in this kind of a situation, and how can you finish your certification? So this is for some countries problem and for the training. So when we speak about the continuous education and support for doulas, we asked, do they have some kind of supervision or peer-to-peer support? And of course, doulas are tight-knit community. 80% have their peer support and they are supporting each other, which is very nice. And when we have this basic training, we see that many of doulas are trying to learn a lot of other things and tools that can help them to be more adverse in many situations. So we ask what kind of trainings other than doula training as a doula have you been to, and so you can see how many different things doulas are also trying to explore to add into their basket of knowledge and skills. So you how to use a rebozo, it's the really high one, or lactation support, childbirth education, definitely aromatherapy, baby wearing. So there is a really high number of additional trainings, workshops where doulas feel that they need to do more and know more. So what we have found out in our questionnaire for our trainers, and that 14 of them answered, we asked what kind of students are coming to a doula trainings. So in most, the prerequisite is just you have to be old enough. You have to be over 18 years. But we know that in some trainings, there is a gender prerequisite, so just women, and some maybe even that you need to be a mother. And in some, occasionally, you have to have a university degree. So even here, you can see how different prerequisites for a doula trainings are. Our trainers from EDN says the mentorship is provided during doula internship until the certification, but sometimes they provide it even after the certification. And as I hear somebody will speak today about this, the medical providers who cross-train in doula skills usually don't have to, do the all of these modules about the physiology and what doulas who are not non-medical persons need to do. But also we have seen that many of doctors or midwives or nurses that are coming to doula trainings are coming to elevate their own work and learn how to be an active listener and how to use the empathic side of them in better working with their own part of the work, the medical work. We do not see a lot of midwives that really decide to go this route, or doctors. And there is a question about taking one hat on and putting the other one in the situation. So we are trying to open this question: can a medical person be a doula and just a doula without the burden of knowledge as a gynecologist? So on this survey of ours, we explored what is the trainings and certification timelines. So we have the shortest trainings, these workshops, 3 days. And then we have 2 years plus trainings that I wouldn't even call trainings. I would say educations. For amount required to finish all the tasks, we have a lot of time, 2 years to 5 years to do the requirements from these trainings. Average time to certification also varies from a couple of months to 2 years. And I think it will be interesting to see how much differences in costs are about the training. Of course, if you have training that is 3 day and training that is a 2 year, it's a very different costs. So we have these two examples where training plus mentorship and a membership fee for the association. So this is a minimum low cost in Europe. It's 1,400 euros. And we have example for very a large sum. I would say that training is just the training costs almost 400 and 500 4,500 euros. So even here we have so much differences in trainings. And duration for certification requirements, usually 2 to 5 years. So these fees are the training, the mentorship, and certification. And mostly, if the training is done by association, then you would be paying annual membership fee. But if we have only members who are trainers, then after you finish the training, there is no membership fee. So this can be separate. You can have just training organization, but also association and training. Some organizations have a recertification, but we see that many don't. And maybe just they need some kind of continuing education along the way to be certified longer. So as this problem with this money and providing this trainings, especially to the countries where we do not have a long history of doulaing and where doulas are new, we have problems that the short trainings are not enough. And for the longer trainings to be made with the local trainer or outside trainer, it's too big of the cost for doulas. So this last year, through Erasmus, my association, Croatia Doula Association, with the partners, also EDN members from Iceland, Hand in Hand, who also have this short workshop trainings, we decided to apply to Erasmus, a small partnership for a adult education, and we created a program, and we created a longer 8 months long additional training for already trained doulas that is free for our members. So this is something that we are the first one to do. And the idea is that when we finish our cycle, that these two countries, Croatia and Iceland, will have more partners around Europe, and we will try to spread this to elevate doulas to a higher educational level, and yet free, because this was the problem in the first place. So what are the requirements? Usually requirements are 3 births. But, also that's a problem, as I said in the beginning. If we have requirements for 3 births in hospital or 3 births in birth centers, you can only do that in the countries that you have birth centers. If you have 3 birth centers and you don't have home birth in this country and you are not allowed in the hospital, this is a problem for the certification. Usually a required reading is in every certification. As last time I said, the Holy Trinity, May, Michelle Adon, Penny Simkin, and of course a lot of other authors. Essay is required for the certification, and then maybe attending a supervision, meetings, evaluation, exams for this process of certification after the training. So also we explored how much doulas make. Can they make a living wage? Because this is also an issue. If we cannot be funded and we cannot earn enough money, doulas will not be doulas long time, and they will not gain experience. And so this is actually a really important question. So we see that doulas are usually self-employed and set their own fees. Sometimes they work in pairs. There are little, not a lot, facility-based doulas in hospital and birth centers in Europe. There is possibility of agency employed doulas, but this is not very common in Europe. We know that in America that is maybe more common. And we see a lot of volunteer work in doulas. Some independent health insurances can reimburse the cost of doula, but this is also very rare. So can you earn a living wage as a doula? Well, no. So 50, almost 60% can't. Only 10% said that they could, and sometimes 20%. So this is a problem. If we were going to train more doulas, we need to speak about how they can stay doulas. And also, 70% doulas have another paying job, which is also a problem because to be a doula, you have to be on call all the time. And it's very hard to make a transition from regular paying job to being a doula and be on call while working, but yet 70% of doulas have other jobs with them. Only 20% are just doulaing. Usually they are paid by clients in full, and we can see that over 25% volunteered their time as a doula. All of these things in between are really, really low percentage. So this is one of the example of the one of our trainings in EDN. What are the topics of this basic training? So you can see what Arre Malalin in Switzerland is training doulas. I would say it's really good example what the basic training looks like in Europe. So yeah, that is me.
Thank you, Anita. That was quite a lot of material, and I think we'll have to, when we get into the discussion, talk in more detail about the sustainability and salary related issues. So I think we were going to go ahead and continue with Carla to go into a bit more detail about what the curriculum entails. And I saw Dr. Bangal was asking a question about the functions of a doula, and I think some of that may be explained in Carla's section. Just to be mindful of time, because we do have a few presenters to, we are missing one presenter, so we I think have a little bit of leniency, but Carla, if you want to go ahead and you can share your slides.
Yeah, hi everyone. Thank you so much to ICI for setting up this session. I'm really happy to be here and to share what we've been working on our doula curriculum. I'm gonna share my presentation. Okay.
Perfect.
So well, my name is Carla. I'm from Portugal. I've been working as a doula since the last 18 years and start training doulas in 2011. I'm the founder of Mater Doula and also the head of our training. So we have been running this program since 2018. It's a 140-hour program spread over 6 months, with the first and the last module in retreat format. At the end of the training, we offer a year of group mentorship, and our team has 6 teachers, including doulas and healthcare providers, specializing in birth, breastfeeding, menstrual cycle, trauma, and perinatal psychology. A quick overview of what we cover. The first retreat is all about introducing the core principles and practice of being doula. This includes presence, active listening, providing emotional support, and also holding space. Participants reflect on what brought them to this path and how they envision themselves serving as a doula. We also open a safe space for sharing birth stories and other womb experiences. Next, we focus on pregnancy. We start with the menstrual cycle and fertility, then move on to prenatal health, including mental health. We also cover how to support clients through abortion and pregnancy loss. And we include here birth preparation. Moving on to labor and birth, we explore the physiology and anatomy, and we try to be as up to date as we can on that. We review the WHO recommendations and become more familiar with evidence-based medicine. So it's a work in progress forever with our work as a doula. We observe the basic needs of women in labor, address common interventions, understand and how they affect labor. We discuss how to support both home and hospital births and how to work with healthcare providers. We explore expectations and fears about birth and motherhood, and we study and practice comfort measures and emotional support. We learn some ways to help clients build a birth plan, and we also include supporting partners or other birth companions. In the postpartum module, we cover the golden hour and essential care for mother and baby in those first weeks. We talk about breastfeeding and perinatal psychology, including mood disorders, baby blues, and emotional challenges of the fourth trimester. Module 5 takes a look at the history of doulas and our role in contemporary society. We talk about the benefits on doula support with evidence-based. We discuss the scope of practice and boundaries for doulas. We present Mater Doula's philosophy, values, and code of ethics. We explore how to build a sustainable practice, business skills, manage time and resources, and also handle challenges. We go deep on communication and advocacy in relationship with both clients and healthcare providers and ways to advocate. And in this module, we also explore the nervous system and trauma. Finally, in the last retreat, we explored the profound transformation of birth and motherhood. We address the emotional side of pregnancy, birth, and postpartum. We talk about trauma, grief, loss, sexuality, intimacy, pleasure. And because it's very important, we take a close look on doula self-care as well. Throughout the training, we cover the doula's role in science through all stages, pregnancy, birth, and postpartum. We work on our mindsets and explore how to provide emotional, informational, and practical support in different situations and settings. We practice authentic and open communication, empathy, and connection. We also highlight the benefits of building community, and we work towards an holistic and inclusive approach. So that's our program. I hope this gives you a good idea of what we do. I know that there's a lot of different kinds of trainings also. But yeah, here is an example.
Thank you, Carla. I think that should hopefully be a really good introduction for people. I am going to go ahead and pass this to Kendra from Common Sense Childbirth to continue. And please keep putting your questions and comments into the chat.
Thank you, Michelle, and thank you, Carla. We're pleased to follow after you to talk a little bit about our program at Common Sense Childbirth. You're going to see we're going to present a little bit today on our materials and curriculum, but also our program delivery and maybe how it's a little bit different than other programs. So first, just a brief introduction on who we are. Common Sense Childbirth is based out of Winter Garden, Florida, and we're a nonprofit that our mission is to eradicate the racial disparities in perinatal health by restoring deeply rooted networks of care and support. And our vision is to inspire change that protects human dignity. So we're trying to solve some problems that are not unique to the United States, but are definitely what we're trying to focus on in these racial disparities that we see in both maternal and infant health in this country. And so we do that through a variety of ways at Common Sense. We have physical location of clinical care. We have a national movement building arm. We train midwives. And then we also have this branch that I am here representing, which is our Training Institute. So at the Training Institute, we train and equip safe, compassionate, and effective perinatal care providers. And now I would like to introduce you to Bianca Nash-Mio. She is our program manager for these training programs, and she's going to be the one walking us through these slides, telling us a little bit more about our program.
Hi, everyone. Good morning or good evening, depending on where you are in the world. My name is Bianca Nash-Mio. I am internationally board certified lactation consultant, a birth doula, and also the program manager for Common Sense Childbirth Training Institute. And as Kendra mentioned, we're here today to talk to you a little bit about our program. Our program is very community-based and community-centered. We think of our program and we call our program a community doula training program. So it's a little bit different in that it seeks to center the Black and Brown community and the experiences that many Black and Brown Americans may face as they go through birthing and their lactation journey as well. So our doula program format does start off with 14 self-paced modules. It is a hybrid program that seeks to be able to meet individuals where they are. These modules can be done via our learning platform, and anyone can use either a computer or a tablet or any electronic device to be able to access our modules. Here to the right, up in the top, we have a picture, just a screenshot of what it looks like when one of our doula participants enters our learning platform. They go through each individual lesson and they have the opportunity to be guided through their birth work journey by one of our instructors talking about one of the topics. So we start off with those 14 self-paced modules, then we segue into 3 days of live training that can either be in person or virtual. For our virtual portion, we do utilize the Zoom platform. And during that 3-day live portion, we work on some of those hands-on portions of doula work, right? So the 14 self-paced modules really walk folks through what is a doula, how can you become a doula, and some of the problems that we see with racial disparities, how to provide trauma-informed care. And then from there, we move to that 3-day live training to talk about the comfort measures that doulas use. And we teach how to actually be a doula in that prenatal, labor and delivery, and postpartum space. We follow that up by offering our participants 6 months of mentorship via one-on-one sessions where we aim to support our participants in setting SMART goals. These goals are typically surrounding their certification. For certification, we ask our participants to support 5 birthing families for their prenatal, labor and delivery, and postpartum times. I heard someone mention before that this can be a barrier for folks who aren't allowed to go in hospitals, and I would definitely agree with that. These births don't absolutely have to be in a hospital setting. It can be in a home birth setting or in a birth center setting as well. During our mentorship, we also have a Facebook group that we created for our participants to stay in community with each other and to be able to answer questions for one another. So, or have mentors answer questions. So if someone's at a birth in the middle of the night and they're like, hey, I have something that's happening, they can pop into that group and write out a question. And someone else who is awake may be able to support them as well. Can we go to the next slide? Perfect. So at Common Sense Childbirth, we used 4 tenets to be able to guide us as we are teaching our curriculum and also in our operation with each other. So the first tenet is access. We like to provide, or we aim to provide, access to culturally reflective materials. So we would like for our participants to see representation of themselves, not only just in the materials that they see and the pages in the book, but also in the instructors that we provide. So we do have instructors that are able to speak different languages to be able to support the doulas who are coming through, who are going to be supporting birthing families. We aim to provide access to education through a variety of forms. So I talked about our self-paced modules. Now those can be accessed online using different types of electronic devices, but also the live and in-person components to be able to meet all adult learning styles and needs. Also, we aim to provide access to our training by creating partnerships with community entities to be able to offset the cost of our training. Our training right now is $900, and that encompasses the 3 pieces that were mentioned before. And for some people, that can be a barrier, and we realize that. So we've worked really hard to create partnerships with different entities ranging from health departments to housing authorities who have then been able to provide scholarships to help to offset the cost of participants coming and taking this training. Many of these different entities have interest in fetal maternal care or fetal maternal outcomes, or they are seeking to be able to provide individuals in the community with access to careers that can change their lives or help to better them. So that has really been helpful for a lot of participants, and primarily most of our courses are taught through scholarships that have been provided by community partners. We also feel very strongly about providing a lifetime certification. So after participants complete our training, they have the ability to be certified. After they complete our training and the certification requirements, they have the ability to be certified for life. We do invite them to join us in different branches of our organization, and we'll talk about that in just a little bit on our next slide. And we keep them engaged and keep them involved also by providing continuing education. We work really hard to be able to come up with different topics that are very relevant to doulas who are currently in the field doing birth work. Also, I want to take a moment to just ask you to note our pictures. Some of these pictures are, all of these pictures are photographs that have been taken at different trainings. So I'm hoping that you'll be able to see not only the diversity, but also the level of training and education we are able to offer to participants in different ways. You see we're outside in some, you see we're inside in some, and all of the participants are very engaged in learning different skills. And this, I think, segues perfectly into the connection and how we feel very strongly about providing connection to our participants, not only just with ourselves, but also with each other. We're very intentional about carving out time to create a connection. We think connection is absolutely important, especially as you work through doula work. A lot of research suggests that most doulas leave the workforce after only about 3 years of doing this work. And that's very, very saddening. It's a super sad fact because we know that families need doulas to be able to help change the narrative and decrease disparities that we're seeing in hospital-like birth settings. So we have our National Perinatal Task Force that allows people to be able to have access to a national and even a global community of birth workers where they can first debrief births. They have the opportunity to be able to talk about what they've experienced so that they do not absorb it and it does not lead to vicarious trauma and other forms of trauma that can potentially impact an individual from being able to stay in this work. We know burnout is one of the primary reasons that people leave this work. So we feel that being able to connect people to community that can pour into them and help them to offer themselves self-care and offer themselves grace is a great way to be able to stay engaged in this work and continue to change the narrative for families moving forward past that third year as they enter that work. We provide connection to our instructors, mentors, and we've even created a position called a student engagement coordinator. All of these folks give their phone, so many of these folks will give their phone number or an email address that participants can reach out to them and ask questions. And I myself find this to be a really, really important piece of the work that we do at Common Sense. Every organization handles the certification process a little bit different. But what many of our participants appreciate is they have the ability to be able to access us, to ask questions, and in real time receive answers or receive support, or be able to have a deeper understanding of how to go about certifying through Common Sense Childbirth. We can go to the next slide. And then knowledge. Knowledge is a really big piece. Knowledge is the third of the fourth tenets that we operate by. Collective knowledge. Collective knowledge is best described as something that we specialize in at Common Sense Childbirth. We like to engage in something called a shared learning experience. I talked about before how we invite participants to speak freely and to share, to connect with each other. But another purpose of this connection and this sharing, putting forth of their birth stories or their experiences, is for us to be able to do something that I like to call gaining experience by proxy. So with our shared learning experiences, we ask participants to maybe talk about their birth story. And in talking about their birth story, we encourage them to share how the things that happened to them made them feel, and then what they felt could have been done differently. And by me hearing someone else's birth story and how it made them feel and what could have been done differently, it allows me to be able to navigate a birthing situation differently or in a way that best protects that birthing person, or it gives me access to information without actually having to experience something directly. So you're able to gain that experience by proxy, my apologies. So active listening is something also we encourage deeply with that shared learning experience and that collective learning experience as well. We lean deeply, like I said, into the lived experiences of participants and then also instructors. We pride ourselves in bringing instructors into the space who have decades of experience to share and to offer to our experience, to our participants, so they have the ability to come into this work knowing that they not only have a mentor that they can call on who has extensive experience, but also knowing and understanding that they've been trained utilizing different methods that have been tried and true over time. You can go to the next slide. And then finally, empowerment. We want to empower our participants to understand the importance of leveraging community resources. So our community doula training focuses very heavily on understanding some principles of community health work, which seek to understand social and structural determinants of health. So we want our doulas to be able to leverage systems that are existing and supports that are existing within communities to be able to support the families that they come in contact with. Many times working as a community doula, you're going to work with more disenfranchised or marginalized populations who really truly have a need to understand what resources are available to them. We work really hard to empower our participants to do this work sustainably. So we offer courses that really part of our mentorship. We offer courses that help people to understand how to do this work without burning out, like we said with the collective care and the National Perinatal Task Force, but also leaning into understanding different ways to be able to make this work for them as well. While we do understand this work is hard work, we also want doulas to know and understand and feel empowered, and they must be able to support themselves and make a living as well. So we lean into helping them understand charging, how much they should charge for birth, and then also utilizing principles such as bartering and exchanging of services and adding on more services to be able to support families. We also encourage our participants to continue to impact the lives of birthing parents and families in their community. We encourage them to become involved in perinatal collaboratives. We encourage them to network, to join to introduce themselves to different clinics, and really immerse themselves in the community so that they are known or thought of as a hub in their community and can continue to provide support to their community. We can go, okay, next slide. Thank you. So here we have a map of the United States. Within the United States, some states have started to reimburse for doula support. On a state level, they provide state insurance called Medicaid, which some doulas are able to enroll to become providers. Each state has a different set of regulations that they set forth and different legislation that they set forth for doulas to be able to enroll to become a state insured provider. And this has been really interesting for Common Sense as an organization because it's really put us in a place where we have to ensure that our curriculum is flexible enough to be able to meet the needs for each individual state, regulations for doula certification, and then also that doula enrollment as an insured provider. Then we can go to the next slide. And then finally, just some tips that we came up with as we are thinking about and talking about and starting this conversation. And I know there are some folks in this space who've already started integrating doulas into their hospital systems or into their systems, period. These are just some things that we see as being important to put forth when thinking about doing this or doing this work. So having the doula program, or whatever you choose to call your doula program, be housed outside of the labor and delivery unit. I found previously in the work that I've done and also contracting with other hospitals as they integrate doulas into their systems, that it can create a conflict of interest if the doula program is housed under labor and delivery, especially as it results, or especially as we look at superiors and who a doula should report to. So if a doula is in a birth room with a provider and they are supporting a family and something happens with that provider, we would like to have the person that the doula reports to be someone aside from that provider that they're in that birth space with. As far as the doula schedules, utilizing rotating on-call days so that doulas have a chance to rest, but then also giving them at least, 8, 10, well, I would say at least 12 hours to be present in that birth space so that they have enough time to stay with the family until delivery. I've seen some programs that allow doulas 8-hour workdays in the United States, and that just typically is not enough time for the doula to be with the family to be able to deliver. Especially if the doula is working 5 days a week, that can lead to quite a bit of burnout. So rotating on-call days has been proven to be quite successful, similar to what we see a midwife working. Leveraging community assets that are already existing and making space for community voice. If you're working in a community that already has access to doula programs, I would always suggest leaning into those doula programs to get an understanding of what the hospital doula program should look like, what the community needs in fact are, and then also inviting those community assets in or picking them first if they would like to be chosen for staffing for those particular programs. I touched on this one before in the first point, but having organized leadership and structured reporting policies. Ensuring that a doula provider has someone to report to outside of the nurses or the doctors who they're going to be working with in that birthing space, because sometimes that can create a high level of discomfort, and it can create a problem where the doula isn't sure who they're actually working for. We know doulas and birth workers are working for families, and they are there to advocate for families. So ensuring that we are placing them in place, we are putting them in a place where they are able to advocate for families and not have to worry about saying something because they could potentially get fired or be reported or reprimanded is absolutely important. So also creating a safe space and protecting those birth workers. And finally, equitable pay. Equitable pay is absolutely important. Here in the United States, we see varying pay in these types of positions, but we want to ensure that we are compensating people appropriately for the amount of hours that they're working and so that they can continue doing this work. We can go to the next slide. So we want to thank everyone from Common Sense Childbirth to ICI. We thank you all for joining us and listening to the specifics of our program. And thank you for inviting us here so that we can tell you a little bit more about our program.
Bianca, thank you so much.
You're very welcome.
This is fantastic. So we've got some questions going in the chat. We're going to go ahead and move on to our last group of presenters. I just wanted to highlight a couple of the questions just before we continue. Sonam is asking if there are scholarships for international students, and Amy was saying that ICEA provides annual scholarships. I believe, let's see, some other organizations do as well. Okay. And then, all right, well, I don't want to take too much time. We will come back for questions. If you do have questions and you need to leave before the end, please put them in the chat, and hopefully some of our panelists, if you want to go ahead and respond to those questions as they're coming in, that would be fantastic. Okay. So I am happy to introduce our next set of presenters. Nonkuleko Shabula is a certified doula, a perinatal bereavement facilitator, and the founder of Umzanyana Birth Services based in KwaZulu-Natal, South Africa. She is dedicated to supporting families through childbirth and beyond. And as a bereaved parent and board member for the International Stillbirth Alliance, she combines her lived experience with professional expertise to provide compassionate care. We are not going in depth about about perinatal loss doulas, but we will, I think, aim to have a session in the fall talking specifically about support to families and healthcare providers for bereavement. I think it's a really important topic. There's a handful of people who are working specifically in this area, so I hope that she'll be able to come back for that session. Tiluna Imhotep is an international maternal health specialist serving communities of color as a holistic health and birth consultant for almost a decade. She's a scholar from Mercy in Action's postgraduate diploma program in international midwifery. Many of you here are familiar with Mercy in Action. She lives and works in the southern US and Ghana, West Africa, where she has been training and supervising holistic doulas for the past 3 years. And Esther Kamani has been a DONA certified doula based in Nairobi for 14 years, I believe. Esther, correct me if I'm wrong. She has recently continued on to become a certified DONA trainer. She partnered with ICI to lead a training for Luwala Community Alliance in Western Kenya to train a cohort of community health workers and traditional birth attendants who serve health centers in rural Migori County. So I am going, Esther, I'm going to ask you to get us started, and then we'll go on to T. Luna.
Okay. Yes. Hello everyone. I'm so happy to be here. In just to listening to all the people that have been talking. It's amazing to see what is going on in the rest of the world, and for us here in Africa, I think we've been supporting mothers through very interesting in a very interesting way, because for generations, like in the community that I come from, a mother was surrounded by a group of women, and they would support her through the whole labor process, and the men would sit outside. And when the baby was born, the women would do something like, so if it was girls, they would do 4, and if it was a boy, they would do 5. But that support system has been there, and so it is changing as modernity has come. It has changed, and now we find like that community kind of aspect of support has gone away. You have to go into the hospital, and some hospitals don't allow that support. And so there's been a need now to have people who are able to support and walk during labor and birth. And so that's the premise where we have seen now a steady need for the doulas. It's still quite a tight space because our hospitals don't understand and what is being done, because there's almost like a confusion, like, are you a midwife? Are you a traditional midwife? So to explain for most of us is that traditional midwives were people in the community who had the knowledge of birth passed on from generation to generation. And they are simply the people who caught babies. They would go catch babies. They have no medical training. It's just knowledge that they have gathered, and that was passed on from one traditional midwife to their daughter. So it ran in families. And we still have those a lot in our rural Kenya, where sometimes access to medical care is not there. And so a big part of our training doulas, part of what the others have shared, simply also just shows what we share, what we train, but most of it is trying to bridge that gap. And so how do we still have a high mortality rate? So how do we help our communities to learn and to get to have doulas in the community, supporting the community? So one of the strategies that we're doing is, of course, we still have private hospitals in Kenya. Private hospitals are big in the cities. And that's a really OBGYN-led model, but we're trying to actually bring in doulas to be able to support those who can pay, and those mostly can afford the private hospitals. But the millions of Kenya who go to the public hospitals, most of them go without care, without help, without having someone to support that continuous help. And so part of it is using these traditional midwives and having them come, train them to be doulas, like that's what we did in Luala, train them to be doulas, and then incorporate them into the health care system, so that they come they are with this, they know this women, they are at home, they've been offering support, but come with them into the hospital, be their doulas in the hospital, and then they'll still be able to go home and continue offering that continuum of care, because we talk about breastfeeding and we talk about all the things that come into that. Our country also recently, our president launched a program end of last year. And we have this, we used to call them community health volunteers. And these were people who just volunteered their time, and they had basic training on, infant care, nutrition, health, and just basic first aid, and just being able to go and into the community and offer this information. And they would volunteer. They were not paid. They would probably be given a little stipend. But last year, the government came in, and now we are calling them community health promoters. And they are actually they've been incorporated into the healthcare system. And so they are now also going to be paid and be actually fully kitted to be able and trained to be able to go out and offer services to the community. The thing is that such for me and my organization is trying to catch that and become part of training those people to actually offer doula support whenever it's needed, because they are part and parcel of the healthcare system, but also they are able to have access to this women as they go to hospital. One of the biggest challenge in our communities is that there's distrust. They really distrust the hospitals. And especially in the community, they say, when I go to hospital, I'm going to get a C-section. But most times it's because they have no education, they have none to support them, they have none to advocate for them. And those are some of the roles that the doula comes to be. And a little study that we did, just very little, we actually realized that when the mother was accompanied in hospitals, there were less interventions. She was able to speak up for herself, just because I think she felt confident that there was someone with her. And so incorporating these 100,000 community health volunteers, promoters that have been now incorporated, we just feel like that's part of the way that we are going. So we do offer these trainings. I offer trainings in Nairobi and across the country. And it's the training is very different. I have two curriculums. I have a curriculum for if you are just a doula, and you are going into business as a business doula, but I also now have a community curriculum, community-based curriculum, and that is geared towards the people who will probably work with organizations that maybe give them a stipend, or into hospitals that are able to have some more money to pay these doulas to offer that support. And yeah, so that's me. Yeah, thank you, Michelle. Yeah.
Thank you, Esther. That was fantastic. So we're going to move on to our last couple of speakers. I know that we are running longer than we expected. So I hope for those of you who are able to stick around for the discussion, we will stay on for as long as we have some of you with us. Okay, so, and I wanted to also respond, the question I was trying to respond to was Dr. Bengal's about whether or not there are online programs. And I wanted to mention specifically in India, there's now a hybrid program that is being launched by Fernandez Foundation. They are not with us because there was actually a family emergency for our speaker. And so she was not able to join us. But they are actively recruiting doula candidates from across India. So hopefully we will have them record that separately and share that out with you for those, especially for those of you in India. Okay.
Thank you, everyone. Thank you, ICI. Thank you, Michelle, for having us. Thank you, all of you who are attending from all parts of the world.
Is the sound coming through okay for everyone?
Yes.
Okay.
Being a doula in Africa is a unique experience. There will be 3 of us who will be speaking from 3 different perspectives and regions on the continent. We all are encompassing our different cultural and ethnic and religious and locational backgrounds. And so my name is T. Luna Imhotep, and I will be talking about being a doula and training holistic doulas in Cape Coast, Ghana, West Africa, from the perspective of a US-born person working here in Africa. Okay, so I think it's important when we're speaking from this perspective that I don't want to generalize, because as I mentioned, I am a foreign or local person coming into the community here in Cape Coast. And from the most part, I've been here for 3 years. I've been training for 3 years here. And for the most part, I have seen a lot of interest and excitement around embracing doulas in the maternal clinics here. And so one of the big things that I like to emphasize and that I have learned greatly is cultural competency. Cultural competency to me goes hand in hand with compassion, especially as a foreign practitioner. We don't want to make people feel as though we are coming and telling them that everything they know and everything that they have done so far is wrong or flawed in some way. And so what I have been able to do here is introduce the concept of a doula, of someone who is providing care and support for birthing and laboring mothers in a clinical setting and outside of a clinical setting. And I've also been given the opportunity to co-work with some of the local midwives here, and not only have them be extremely interested in the work that we do, but also see value in the work that we do. So a little background on that is that I am a holistic doula trainer and facilitator here. I work for an organization called A Life of Peace Wellness Institute, and we have an organization called the Doula House, where we train holistic doulas here in Ghana as well in the US, as well as in the US. And so while most of my students have been diasporan or foreign born students who have or students have come from the US or abroad to train with us here, we get an in-person practical experience, hands-on experience working at the local clinic, serving with the local mothers here. And that has been, without a doubt, the most transformative experience for the birth workers that I've had the privilege of training. And not only that, for them as birth workers to prepare them for their career, but also for the families that we serve here, them getting an opportunity to experience this service that is often seen as something that people who, for better or worse, have money can afford these services. We are serving families who may not be able to afford these types of services. And so the hands-on and practical experience is without a doubt absolutely necessary to not only build the confidence of doulas and birth workers, but also to connect the work that they will be doing with the service of being able to facilitate, to be alongside birthing people in this experience. So I want to just talk quickly, just say some observations that I believe have been really important in the work that I've seen and been doing here in Ghana. Making trainings and workshops for community education. So, sometimes the communities that we serve aren't able to afford the classes and trainings and everything that it might take to become a doula necessarily, especially in a certifying body or a larger organization. So making trainings accessible and workshops accessible to the community has been, without a doubt, one of the most transformative things that I've been able to do here in Ghana over the last year. The accessibility for local languages and or non-literate people, I think that's extremely important, because we don't assume that just because someone is non-literate that they can't understand, comprehend, learn something, right? And so that's why the hands-on practical experience has been really beneficial for serving people here, but just I think in communities of color across the world who may not work most in theory, but very much in practice. And then assessing the specific needs of the community that I serve here and not projecting foreign-based concepts onto them. And so understanding that the people that I serve where I am now come from their own cultural and ethnic backgrounds, diverse and religious backgrounds. A lot of it is extremely diverse. They are not a monolith. And so there's no way to just say, this is the way that you have to allow me to serve you, So being understanding that the community is as asking for what they need from myself as a doula and the people that I, train and educate here as well, and being able to respond to that request instead of trying to put on to them what I think they need most or generalize their care. Absolutely, it has been an absolute way in which I've been able to be of service here in Ghana, but also back home in the US as well. And with that, I will pass the mic to Nonkoleko.
Hi, greetings everyone. My name is Nonkoleko Shibola. I am a South African trained and certified doula by profession. I am also a bereavement facilitator, perinatal loss bereavement. So I'd like to touch on a few points based on today's topic. Thank you so much, ICI, for having me, as well as my fellow colleagues. So I have increasing doula training programs in South Africa. When I started training about almost 5 years ago now, it was during COVID, right? And there was not much doulas that I knew of until I went into the program and I started training and experiencing. So I have been noticing that over the years, the information, the need for doulas and the need for the training and experience and what it means to be a doula, what does a doula do, just because now I had a doula as a mom would say, and they want to know more. they would also want to be a doula themselves. So the numbers have been increasing, and we're looking at highlights of a growing recognition of the importance of skilled birth support. So nonetheless, the perception of doula services as a luxury as well has also came into part. So despite the increase in trained doulas, many doulas don't actively practice. So this means they train, or we train, and they after training and the certification and everything, we don't practice fully. And this is because of the amount or the prices, the fee that doulas are supposed to be charged as per our regulatory bodies, if I may put it that way, our standard fees that we charge, and then it's actually ends up being seen as a luxury, or something that certain people can afford, a service that certain people can afford, and then some others cannot afford. And for that, most doulas are out of work, and maybe they are demotivated because of that. So what I did is I started mentoring those who were interested in becoming doulas, just to prepare them for what happens after the certification. And then they would make they create a sort of a business plan, and how they can incorporate their training into something that looks like and feels better to them, was into, if I may put it that way, like identifying their training uniquely to how they would serve their communities, because each and every community is different. So that, and then we have limited financial supports and sustainability. In South Africa, doulas are only paid by the medical aid or medical insurance when the birth is natural, and when the doula was present in the natural birth. So if it is C-section, they're not going to get paid by the medical aid. They're not going to pay them. So some parents will afford to make the payment from their own pockets, and some parents may not afford. So, and that's another limiting thing that happens in the doula space here in South Africa. So we are working on that as doulas who are interested in doing the work and are willing to take the doula space in South Africa forward. So what does that look like? In my province, KwaZulu-Natal, we have a collaboration and volunteer work with our public hospitals. So I am currently working with one, and we are building a relationship with them. So far, the relationship is growing, and the reception from the midwives, by the midwives and the nurses and staff, is positive. So with the growth, we are looking at maybe in future having doulas being incorporated in public health as well. And seeming that they are starting to also soften up, introduce what is called companionship. So, but then we are not calling ourselves companions, and we're not calling the program companionship. Just to differentiate between a companion and a doula. So we just wanted to make it clear that a doula is a doula, and they do what doulas do, and then companions are not replacing doulas. And yeah, so that's part of the programs that we're doing. Going to move on to what is very close to my heart, which is bereavement work. So doulas not only needed when the birth is live and the baby is healthy, and everything is going well. So it happens that sometimes the baby doesn't make it, and then with the community that I am currently working with, there's not much conversations about doulas being incorporated or working in bereavement care, and I understand why. But that only does not affect our community, that is our mummies and our parents and families. but it also affects our healthcare workers as well. So there is reducing stigma and isolation in bereavement care. That is one of my main focal points, and the reason I'm doing what I'm doing in bereavement work and perinatal care work. So providing platforms for education, awareness, and shared experiences. We have support groups, we have WhatsApp in-person support groups as well. And then we have workshops that we do with healthcare workers, and we have workshops that we do with parents as well. So just to balance the scale, because when we pay attention to one, we also need to hear stories from both sides, and we also need to attend to the mental health and emphasize mental health care for both clinicians and community as well. So that is promoting mental health and emotional well-being for all, and involving community leaders as well. So our community leaders play a huge role, especially in advocating for us doulas. I have seen this happen, and it's still going on. I feel like they understand what doulas do better than anybody else. So we do the work, and they help us advocate for. Okay. So the last point is healthcare workers, empathy, compassion, and bereavement care. So this has been very close to my heart for the past 12 months, mainly because I have been focusing on parents group and parents voice advocacy. And I have seen a lack of care when it comes to our healthcare workers and people who are first responders or first-hand responders, if I may put it that way, in bereavement care. So they wouldn't know what to do when there is a stillbirth, or how to take care or maybe handle after effects of the stillbirth. So there is mental health and addressing mental health issues. And when a mommy goes home, they're all alone by themselves. They don't have anybody. They don't have referrals. They wouldn't know what to do. So as a doula, I would jump in. But I have started doing sessions with healthcare workers based on that as well, because I believe as much as we are African and we are very much interested in having our babies home and in comfort of our own homes, but not everyone will opt for that, and not everyone will comfortably say that, I want my babies to be delivered by just a midwife only and no doctors. There's a very huge stigma when it comes to our families, and it'll take us I always say it'll take us maybe 20 years to get everybody to understand what is holistic childbirth care and what it means. So we are doulas, we do not judge, we do not isolate, we support each and every birth that mothers opt for. So this includes live birth, and it includes when baby doesn't make it with maybe anticipated loss, and stillbirth as well. With past 5 years experience that I've had, and I'm still growing into this doula profession, I am learning every day, and I'm not the only one who's learning. I always believe that passing on, or the way that I serve community, will be passed down from generation to generation. And this will be easily done if I do my work correctly, or if I do my work wholeheartedly, and then they will be able to pass it on to the next person, because it doesn't take education for one to really understand what it means to be supported. So I have seen growth. I have to be honest, here in South Africa, I am seeing growth, except for the challenges that we are working to overcome. And also, just like how Luna has said, cultural competency is a huge issue, and that has been a challenge on my side as well. And maybe you will see that our doula training bodies, they would have like 1 or 2 pages of cultural competency, and not basically touching the nitty-gritty and the important, very important parts of birth work that will be unique to each and every person, not just a particular group of people or particular group of women who are willing to be served. Thank you so much.
Thank you so much to Nonkuleko, T. Luna, and Esther for all of your contributions. So I'm so grateful that a lot of you have stuck around to this point in the discussion. If anyone, we've had a lot of really fantastic contributions and questions in the chat, but if anyone wants to go ahead and unmute and ask a question, or especially any of our speakers, if you'd like to give a comment to anything that has been raised or to add any points, you can raise your hand or you can go ahead and unmute, and please don't be shy. If not, I'll start highlighting some of the comments from the chat. Does anyone have, would anyone like to respond to any of the questions that have been put into the chat?
Well, maybe I can speak about our international future plans as Istanbul Birth Academy. As you know, well, it was a very short notice, for me, but I can little bit talk about our training program. Not very long because of the time limitations, but most maybe different thing is we as an umbrella. We are actually getting doctors, midwives, nurses, doulas, and psychologists and physiotherapists in the same training course. And it takes 2 years altogether. We are also aiming to do this Bulgaria in Sofia as an international step, let's say. It's going to be a Bulgarian translation. 2025, but also we are aiming to give more international trainings. But our purpose is, as Dr. Hakan, we are working together. We want to do doula trainings not only online, which is very important for us. So of course it is for the travel issues, it is a little bit difficult to arrange the curriculum internationally in person, but of course there is a need, so we will do it. And we believe, if the obstetricians, midwives, doulas, and psychologists, these all colorful and rich colleagues, let's say, to understand what is doula working, how is it working, and this also increase the teamwork together, which is very important. So I want to mention this also. Thank you, and thank you for this lovely meeting.
Thank you, Nishe. That's a really, that work that you're doing is really important. I don't know that a lot of people are. The only other partner I know that we have in Brazil, the Sophia Feldman Hospital does put their obstetricians through doula training as well as part of their sort of standard education. But I think it's really innovative what you're doing. And it's great that you're expanding.
Mm-hmm. So Dr. Hakan maybe can put our website and everybody can reach us to ask questions in order to not to use time.
That would be wonderful.
Thank you.
So I see, okay, so Layla Baker was asking if there's a way for international doula training organizations to be in touch with each other. Let's see. I know that we've been trying to sort of serve as a link to help to connect some of you together. I know that I don't know if anyone would like to comment about that, Debbie or anyone.
Yes, within the European Doula Network, we're part of our our remit is actually bringing together international training programs. So nearly half of our members are training programs across Europe. There is definitely an interest in sharing expertise and working together. So within Europe, as Anita was saying, within the Erasmus program, in fact, it's always in a collaborative way where two organizations come together. And Anita could elaborate on that. But we're definitely interested in the sense of sharing expertise and supporting doulas. So when we were at FIGO presenting doulas, it was something that was magical to get together with ICA and with DONA and with any of the other doula partners of ICI to really give wings to everybody.
Tiluna, I just saw that your comment about looking for workers in Brazil, and I know that we have a lot of ICI collaborators in Brazil. I don't think anyone is here right now. Sylvia is asking.
Maybe we can.
Oh,
I'm sorry.
no, go
about
ahead.
Brazil contacts.
Mm-hmm.
Maybe if she wants, she can reach me, and
Yes.
I can send her a few contacts. Okay.
Perfect. Thank you, Carla.
Maybe I would just add that every year, European Doula Network organize a conference for doulas where we meet. So every time it's in another country, and it's a place where we speak to each other, trainers, doulas, representative of associations, where we share knowledge and ideas. So if you are Europe-based, please get in contact with EDN.
So thanks, Anita. So Sylvia's asking a question about whether or not in Africa there is education about supporting women who've gone through female genital mutilation. Can anyone respond to that? I think maybe.
I can say something briefly only because I'm in West Africa. So,
yes.
Genital mutilation doesn't happen everywhere. Africa's a huge continent. And so, it's a cultural thing and it depends on the location. I have not met women who've experienced this. I believe it is illegal in Ghana where I live. Other parts they might still practice, but I've not met anyone who's faced with this. However, I do believe that so from my experience here in Ghana, doula, birth worker education is new. We are the ones bringing it, and only in the last few years have more doulas been here. But we, as birth justice advocates, we do talk, reproductive justice advocates, talking about female genital mutilation is a huge part of what we do. And so I will say that here in Ghana, we will, if that's something we come across on top of all the other things that we're speaking about within reproductive health, that is something that we will educate people around. But I will say that practice is a regional thing.
Right. I was trying to think of some other impacted countries. I think Egypt, and I know that there are some Egyptian doulas, but I don't think we have any with us right now. Rose was asking about doula training in Haiti. I'm not aware of any organizations yet that are thinking about training doulas in Haiti. I don't know if anyone here. Wants to comment about that.
I briefly mentioned in the chat that there is CIBEL training, which is French speaking, because I imagine French would be very helpful in this situation. So they're international, Canada, Belgium, Switzerland, and France.
Okay. Thanks, Debbie. Okay, sorry, there's so much activity going on in the chat. I'm trying to keep up. Does anyone want to go ahead and raise your hand and just if you put something into the chat or if you just have a comment, anything. Um, Otherwise it's just me hunting down the questions.
Hello, everyone all over the world. It's very nice to meet you with very nice people all around. My name is Clara. I am an OBGYN in Quito, Ecuador, and we do not have any doulas in our maternity centers for the government, but I think we have certified school for doulas in here. There are just a few of them working in private clinics. For me, their work is very amazing. All of the maternity centers should have in the labor and delivery room one of them supporting and helping a birthing mother. We have implemented in our unit the companion partner or family who wants to be with the birthing mother. But most of the time, the companion person is not the best. Maybe it's just for companion, for supporting, but they do not have the knowledge to help how to implement the measures for support or decrease the pain, for example, to rebozo maneuvers or massaging. We have implemented aromatherapy, music therapy, massaging, but all of us who work in the labor and delivery room, we have gotten some knowledge watching videos or reading books or watching the ICI recordings in the YouTube channel and doing this and supporting the mothers and also trying to improve the experience for the family in that special time of their lives. But I really recognize and the doula's job, and I think they should be in all of the labor and delivery room. Thank you.
Clara, thank you so much. I wonder if it would be possible for us to try to connect with the
Sure.
It would be interesting to talk with them because I didn't know that there were trainers in Ecuador.
Yeah, I do not have the exact information, but I know there is a center of school or something where trains doulas. Yeah.
Yeah, that's fantastic to know.
Yeah.
So thank you so much. I don't know if anyone would like to give any feedback or comment to what Clara is sharing. But I see everyone is putting a lot of resources and information into the chat. So I'll compile some of the links and the information that if you're putting resources into the chat and links, we will send out an email after this with the recording, with the resources so that for people to follow up. And if anyone is missing a contact or a resource, you can also reach out to me. And I have everyone's registered for this session, so I can connect you. But my email is, if you don't have it, is mtherian@icichildbirth.org. I'm just putting it in the chat. Yeah, so Brianna's saying that there's a training center in Puerto Rico, Central Mom, and that's true for a lot of the resources in Haiti. I've noticed a lot of the Haitian healthcare providers speak Spanish because they have to go to other islands. But I'm thinking especially for the doulas, I think that it would be great if we could try to develop some resources in Creole if it's possible. Okay. Oh, and Sylvia. So Sylvia's mentioning refugees in Germany. So that's actually something that I think we haven't explicitly talked about in today's session, supporting refugee communities, and the role of doulas in really supporting minority groups in regions. I know, Carla, that's something that your group has done. Would you mind commenting on about that if you're still with us? I know we're running
Yes.
Go
Yes. Since 2021, our organization started to partner with refugee center in Lisboa. And since then, we've been working with refugee women that are crossing the pregnancy, birth, and postpartum. It's been a very, very interesting and important work for us as volunteers, because this is a volunteer work that we do, and also for the women and for the center, because what we understand is that this kind of facilities pregnant where women are, but they get pregnant at some point somehow. The thing is, we believe that these kind of institutions are not ready to accommodate and to work with them in best ways. So we believe that our role was also to bring some more information to the refugee center and to work with them in best practices for women, for pregnant women and women with child. So yeah, it's been very, very nice project. We will spread it in other directions, like women in prison, women in shelters, and this kind of work.
Thank you, Carla. It really highlights the disconnect between the families that need the care, the doula care the most, and those who are able to, pay for it. And the fact that the doulas are not getting paid enough brings us to the point that Hakan is just making about salaries for doulas. Hakan, I don't know if you want to unmute. Are you I'm not sure who exactly you're directing the question towards. I might have missed it.
I just ask it to the general population. I mean, sometimes we are trying to do a doula work like being paid as a salary, but I also question, I don't know the answer, but being paid as a doula, I don't know if it will work or not, because a doula work comes from heart. I mean, not obligatory something and connections. So any salary work will not work properly. But for people who cannot, of course, afford it, it's a great solution. That's in the chat why I said we tried something like this in a city hospital in Turkey. And this is the 5th year. We gave them doula education to midwives and new nurses. They are paid by the government as a midwife or nurse anyway, but after their original work, they go to the hospital for night shifts as a volunteer. I was also suspicious if it will work or not, but it is still working, because what they say is, I go there for myself. I mean, when I come together with women and help women, I am also cured. I am also healed. So they continue this is the 5th year and they still continue. But being a doula with a salary is not easy work. It's not really, I don't think. Then they will hire nurses and midwives work like that, for example. So I am in a conflict also. I just put that into action. And also I will have an offer. This meeting is great to start with, but it looks like that everything seems perfect. But I know very well all the doulas, starting especially in new countries, have so many challenges. They are neglected. I mean, they have so many problems, especially by the doctors. They are, they say, "Who are you? I will not let you in," and things like that. So maybe we can have a webinar. We just focus on the challenges and the problems of doulas, especially in new countries. For example, in Turkey nowadays, there is an intention that they will stop doulas working in hospitals. And the main challenge comes from the midwives. They think that doulas are stealing their work, which I never believe in. I will never believe in that because all the doulas support midwives. We all know this. But with their, push, the government is trying to focus on doulas and their work nowadays. So let's talk about challenges one day. That's my offer for the future. Thank you.
Thank you, Hakan. I mean, you're bringing it back to exactly what we were going to talk about. So Bianca, I'll call on you in just one second. But actually, we were hoping to have that discussion now, but I think we're running out of time. And I was thinking as I was listening to everyone that we might need to have a part two. I don't know if everyone wants to come back and have the discussion. Bianca, do you want to go ahead and unmute?
Yes, perhaps I can hold my response until part two if you would prefer, where
No,
we
go
can
for it,
dig in depth
please.
in that
Please, please.
discussion. But just responding to what was stated previously, yes, I do believe that there is a way to feasibly provide a doula with a salary for them to do the work in a hospital or in another setting. I think it's about ensuring that you're setting pretty plain and clear guidelines as to what a doula is, the work that they will be doing, and the hours that they will be working. I don't think that it takes away from the fact that it's hard work unless you take away the doula's ability to be able to do what a doula would normally do, right? So if a doula doesn't have the ability to advocate for the family, to work with the family, and to spend time with the family and support the family, I think that takes the hard work piece out of it, and it makes them another member of the labor and delivery staff, right? So allowing them to have access to the family and support the family outside of just that initial visit to the labor and delivery ward or unit to be able to deliver or support as a family is delivering a baby. So I think it looks like how you're structuring that doula's work and ensuring that it stays really close to what a doula would typically do. Seeing a family during the prenatal time, labor and delivery, and postpartum as well. And then allowing them to be in connection with that family and not making it so they only show up, like I said, when it's time to go.
Right.
Thank you.
Thank you, Bianca. Yeah, I agree with you. And I think Brianna was comment in the chat saying that that the payment comes with control of the person of the group that's paying. I think that is a really important comment because there is also the issue of the fact that doulas, it's unfortunate that the doulas are being paid directly by the family in the majority of cases, but that also gives them their allegiances only to the family and they're not part of the staff. So that gives them sort of a freedom to play their role independently of the facility. And, as we're seeing facilities start to understand the importance of doulas and to take on doulas on their staff, is that going to change how impactful the doulas are if they're getting paid by the facility. So then now they have some responsibility or supervision and they might lose some of that. So we're really in a bind, I think. And yeah, and having midwives advocate for doulas would be really helpful. I mean, this is a big piece. This is something that ICI has really been actively advocating for. We're pushing really hard within FIGO. Deborah, I think, is still with us. I'm not sure. With putting together a statement, we're trying to get FIGO to formally endorse doulas. We've been trying to make sure that doulas are mentioned when FIGO releases statements anywhere where it's applicable, so that the obstetricians understand that the doulas are part of the unit. And this is something that we're really hoping to see a lot of movement in the next couple of years. We right now have some supportive members within the leadership that are helping to move that forward and with the midwives as well. But I think that smoothing over those relationships And I think part of what we were hoping for today was by having all of you contribute and really talking about like what is it doulas do so that we have like the healthcare providers have a really good understanding.
May I add something?
Please, please.
Yes. So Nesha briefly talked about, but speaking about our challenges as doulas, also when doctors join the training in Istanbul Birth Academy, doula training, they grow so much empathic skills toward doulas. So, for example, we as doulas, when we go in birth with those doctors, we are a part of the team. So sometimes as doulas, we imagine if this spreads to the whole world, then that will be also very good to have less challenges as doulas. I know it's not easy, but would be really nice.
Yeah. And Layla is saying that she's training doulas to volunteer for hospitals and she's trying to help prepare them for the potential conflict of interest. Layla, where are you? I'm sorry if you put it in the chat. I'm having trouble catching up with everyone's feedback. In the UK. Oh, fantastic. That's wonderful. What are you doing that for multiple hospitals or for a specific region in London? That's great news. Yeah. There's so much misinformation, Hakan, as far as the sort of expectations and the conflict between the professionals. Okay, well, we are at 2 hours. This is our longest session, and we're not even really properly done, so I don't know. I want to thank all of our speakers again, and I just want to mention, I'm sorry that we lost them, but Fernandez Foundation in India launched their first, I believe they're the first Indian doula trainers. They've developed a locally adapted hybrid training, and they just launched their first cohort of 16 doula trainees in July. So they are recruiting, for those of you who are in India, they are recruiting potential doulas from across India. And hopefully we'll get them to speak at another, maybe we clearly need a part two. So maybe we can have them come back and talk about that. So they've done a hybrid training. Part of it is online, I think, because of the geographical distribution, but they are making sure that they have an extended mentorship period and they are having their trainees follow 6 births to get certified. So they're doing 3 hospital births at Fernandez Hospital and 3 midwifery center, birth center births. And Vijaya, who was with us, is one of the centers. And we've lost everyone. Okay, so okay, well, thank you so much for your participation. Thank you so much for all of our speakers. Really, really grateful. And I'm sorry we did not highlight more that the International Journal of Baby and Parent Education released a full publication just focused on doulas, and EDN has an article that is linked in the chat right now. So we'll include that information when we send out the recording. Thank you so much, everyone. This is our last webinar for, I think, a couple months. We will resume again in October. I'm hoping that we will be talking about perinatal loss and have Nonkuleko come back and talk about that. We have a bunch of interesting topics lined up. I will send out an email, and if you have suggestions or topics that you'd like us to cover, including maybe continuing this discussion, please send me an email. Ray, are you still here?
Yes, I am. I'm still here. And I'm very impressed. And I look forward to the second session. As a doula trainer, for those of you who don't know me, I didn't introduce myself in there, but I've been training for a long time, over 25 years. So I it's amazing to see what everyone is doing. But I did put a question in the chat that I hopefully will be part of session 2, what doulas do not do. And that's the part, that's where we need to reach out and meet the naysayers, the ones that are saying, and don't like doulas because they think that doulas are taking their place or they're intruding or whatever they're saying. Hakan, you discussed that well. And so that's an important discussion. However, this is the choir here. We need to get those that are saying no, no, no to doulas. So spread the word. Let's get them in on the challenges. Yeah. Let's make them the speakers.
And that's a good idea, right? And I'm afraid we had someone here from Vietnam in the previous session, but they were sharing that, I think we would be great to get into some discussion about the national policies, but in Vietnam, apparently there is a policy that they are not allowing doulas in any of the facilities. But what the result is that there are international organizations training in Vietnam, and those doulas now are only attending home births, but there are no home birth midwives. So the doulas are stuck attending births alone, which is not something that they're intending to do. But as a consequence of these policies of not having home birth midwives and not letting the doulas into the facilities, once you're a doula, there's no place that they can go except to attend these home births. So it's really like the policy issues are very, very sticky. And I think it would be really good to get into that. Oh, Debbie, yes. The opinions of health professionals. Yeah, sorry, go ahead.
Well, at FIGO last year, we actually did a pilot study. So we surveyed 250 health professionals from doctors, obstetricians, midwives. It's a long project because being volunteers, it takes a long time to keep these going. But if this could be helpful, we can talk about how that project can come to fruition and hopefully complement a future webinar on the opinion of doulas within the health work world.
Yes. Yeah, that would be great. Okay, so I'm going to go ahead and close the session. Thank you again. I'm really grateful also so many of you for sticking around for 2 hours. Thank you.
Thank you all. See you later.
Thank you, everybody.
Oh, Nesha, your cat.
So cute.
Thank you. Bye-bye.
Bye. My cat is also just
Thank you so much. Bye-bye.
Bye.
Thank you, Michelle, for this great meeting. And I appreciate the answers to my question. And actually, if Luna and Amy and Brianna can get in touch with me on my personal email so that they can send me, the resources that they mentioned, especially, for example, Amy talked about Father Luis Mirosne. So it would be great. I don't think they saw my question and answered. So if you could please get in touch with them and ask them if they can contact me personally.
I can connect you. And I know there's also we have a first ICI site in Haiti and some other midwife groups. So I think if we can maybe connect everyone and see who has experience and interest in doulas in Haiti, it would be much needed.
Okay, thank you so very much.
Bye, everyone.
Have a good day. Bye.
EDN does love surveys. The surveys are fantastic. Bye, everyone.